Happy Wednesday. Welcome to Mastermind Session, The Brilliance of Diversity and Inclusion in the Workplace, Part 2. We are living in unprecedented time globally where diversity and inclusion is essential to innovation, creativity, and problem solving across all industries. Today, we will continue the conversation where we evolve and heighten the importance of diversity and inclusion in organizations of institution of learning and healthcare institutions as a whole. My name is Tanya Kimber Jones, and I am the Workforce Solutions Interim Director and member of the Diversity and Inclusion Council at Chamberlain University. Today, we have joining us Bill Lumani, who is the Senior Director of Human Resources at Chamberlain University. Bill is responsible for leading the human resource function for Chamberlain as well as leading the growth initiatives team for the university. Bill has worked for Adtalem Global for 15 years, working in a variety of roles in human resources. During that time, including helping to launch the organization's first enterprise HRIS, as well as launching and managing the HR call center that supported over 12,000 colleagues globally. Bill is also a member of the Chamberlain University Diversity and Inclusion Council. Bill holds a bachelor's degree of science from DeVry University, as well as 2 masters from Keller Graduate School of Management, where he has a Master of Business Administration and Project Management. Welcome. Thank you for joining us today, Bill. In addition, we have joining us Dr. Doris Jackson. Dr. Jackson is the president of Chamberlain University's Pearland campus in Texas. She brings 40 years of academic, administrative, and clinical experience to her role. Prior to joining Chamberlain, Dr. Jackson held a range of leadership and academic positions at Lone Star College, most recently serving as the executive director of the RN to BSN program. She brings a tenure at the Houston-based college system as a professor, faculty, and clinical instructor from levels 1 through levels 4 nursing, and eventually serving as the director of nursing program and interim dean of health and human services divisions. Early in her career, Dr. Jackson focused on nursing practice and nursing education at Texas Children's Hospital. She has also served in a variety of roles within Memorial Hermann Health Systems, and she has served as a clinical nurse manager, clinical specialist, and educator resource specialist. She is also a big advocate of diversity and inclusion. Thank you for joining us today. As we get started with our conversation, I would like to get started with our first question about, the importance of diversity and inclusion. Bill, can you talk to us a little bit about why it is important for healthcare organizations or global organizations and institutions of learning to foster an environment of diversity and inclusion?
Well, that's a great question. Thank you. I think diversity and inclusion is so important, not only in healthcare organizations, like you mentioned, but all organizations across the country and across the globe. And it's for a number of different reasons. You have, a new lens of expertise and experiences and thoughts from people that will ultimately lead to better success for an organization. And you have more creativity, you have more engagement. It's been proven in surveys far and wide. Harvard Business Review actually had a study back in 2018 that said that organizations that had higher than average diversity had on average 19% higher revenue than those organizations that did not. So there's a number of different reasons, and it's cited far and wide. Studies continue to be done on this and surveys and whatnot that shows the importance of diversity and inclusion in the workplace. At the end of the day at Chamberlain, what we want is a welcoming and inclusive environment for everyone, and that's what we're striving for.
I liked how you talked about how diversity and inclusion helps to bring revenue because you're tapping into talent that can speak to a diverse audience, and you're bringing inclusive content that is going to be meaningful when it comes to products and services that you offer to that diverse audience. It's not a one size fit all. You're tailoring what you need to meet the masses. So thank you for that. Dr. Jackson, I would really love to hear from you, your perspective on this as a leader in education in an institution of learning, and as a colleague who has a diverse background in healthcare as a whole. Why do you feel like it's important?
Well, to piggyback on what Bill just stated, that it is encompasses everyone, and we can see now with this new generation, we have some diversity and inclusion work to do. But to start this off, I wanted to actually get the definition of what is diversity and what is inclusion. And diversity means just that, it's being different, a difference in culture, a difference in race, and with education, a different with the thought process, but also understanding one another, each person's uniqueness, and not knowing that for yourself, but recognizing all individual differences. Not only being able to recognize those differences in others, but to teach those students as well as faculty that we need to research on things that we're not familiar with, and yet we need to research and verify things that we once heard and maybe we need to be sure of. And then with the word inclusion, it simply means to be included. Everyone wants to be included. That inclusion means also to be part of a team, to be part of a family, to be part of a group, a profession, as well as an organization such as Chamberlain, and any institution of higher learning. Now, all three, healthcare, organization, and institutions of learning, have a common denominator, a common thread, and that is that all three are in the position to capitalize on the diverse of individual strengths and individualized creativity. Thus, when they do that, it allows the team and the organization to enhance their growth. And their growth is where they are planted so they can mature and move on. When teams are given as leaders, when we're giving our teams the necessary tools that they need to be successful, it causes this domino effect. That domino effect not only enhances the individual, but it also enhances the team. It will improve teams' morale. They will stay longer, and that's that retention. It will improve the organization's brand, and that in turn will attract and inspire other professionals to join their team because they will have the synonymous vision and mission of our organization. The importance of diversity and inclusion, however, in each of these is having the ability to enhance decision making in the workplace. People, faculty, and students need to feel that they are treated fairly, that they are treated respectfully, and they have equal access to opportunities and resources that will not only enhance themselves, but also the success of the organization, which Bill did state that previously. Thank you.
You really outlined some really valid points. And I loved how you talked about that domino effect. Because when people feel value, they do feel a part of the team. They do want to be a part of the evolution and the growth and the success of their organization, or how patients are treated, or how students learn. So it's really important to identify how those things play into each other. So thank you for outlining that for us and really highlighting those key elements that make it so synonymous with the growth of an organization. Phil, did you have anything that you wanted to add or follow up with? Because you had that look on your face.
Thanks for picking up on that. Yeah, I did. So, Dr. Jackson, you made a great point about the decision making being enhanced and being better as a result of diversity and inclusion. I couldn't agree more. I had a boss many, many years ago tell me that she did not want to hire people around her that thought the way she did and that came from similar experiences that she did for that very reason, right? You want to have different perspectives. You want to have different experiences from people so that ultimately you will have better decisions being made, which will lead to more success ultimately. So I think that's spot on. I'm so glad you mentioned that.
It's so key. Oh,
You
Dr.
know,
Jackson, I didn't want to
One,
interrupt you. Go right
no, one
ahead.
of the things to piggyback on what Bill said is now this is bad English, so don't ever repeat it. But I remember they said, if you always do what you've always done, you always get what you always got. And that is reflective of having someone to come in that can provide different decision making processes. Thank you.
No, oh my goodness, that is so powerful when you really think about it. Because in order for you to get where you want to go, you have to have different perspective and you have to have different insight. So it's really important to think about it from that lens. And Bill, I really liked how you talked about how you had a boss who, you know, led you down that pathway of saying you have to have different people around you in order to get that different perspective. And it is something that I also subscribe to, because my way is not always going to be the right way to get things done and move an organization or a team or students forward. So having that different insight, that different perspective, and being conscious of putting that into practice and diversifying those people that you bring around you is so key. So I want to go to you, Dr. Jackson, to ask you a little bit about, the impacts. We touched on it a little bit with, our conversation here, but I want to hear from you about the impacts that diversity and inclusion efforts have on professional development of minorities in your organization or in an institution of learning, rather.
There are negative as well as positive impacts
Okay.
regarding the diversity and inclusion for professional development in minorities. When you look at professional development, if speaking of students, you have to have the diverse faculty, first of all, because so often students will be more compliant when they can see that they have someone that's similar to them that can maybe speak their same language, and that maybe can offer the same things that they can. However, negatively, if we do not provide the professional development, we're stagnant in that development, in developing our faculty. And we don't want to be stagnant. We always want to nurture and provide and enhance what we have. And in order to do so, that has that effect on students. So there is a very, very large impact, and it can be done negatively, but it also can be done positively once we identify what those areas are that we need to enhance.
You touched on the importance of why you have to have that diverse faculty and how it creates compliance amongst the students. And what I've heard just in the community, to identify with what you're saying, is that students do resonate. It allows them to see that they can do and they can achieve things because they see someone that looks like them in those positions. They see a faculty member, they see a nurse leader, they see a president of an organization such as you leading the charge and making it possible for them to think about the possibilities. So I appreciate you highlighting that for us and walking us down the pathway of the areas of opportunity as far as negativity, as well as the possibilities in a positive light. Bill, as a leader in our institution, as well as a global leader for HR, why is, it's so important to cultivate professional development and tap into that minority talent?
It's so important because you want to make sure that you've got an institution and an organization that is welcoming and inclusive for everyone, and that you're developing people along their career path and you're giving them opportunities to meet and exceed their career goals ultimately. And that's what it's all about. We've got a number of different professional development programs here at Chamberlain and at Adtalem that I'm very, very proud of. And we make it a point when going through the selection process to ensure that we've got good diversity across the cohorts and across the groups of individuals who have been selected to be a part of the development programs and go through our programs. And so we're very deliberate about it, I would say, for the very reasons that we mentioned earlier, right? We want to make sure that we've got those different perspectives. We want to make sure that we've got those different experiences and that people understand that, there's much more to the world than just what you see yourself and the experiences and the lens that you see it through. And so it's important that people recognize that and work together to go through that and like I said, meet their career objectives ultimately. You know, it's one thing, talent is at the very core of what we do in HR, right? We have a talent first agenda. We talk about it all the time. And so there's two real important pillars as it relates to talent. Number one is talent acquisition and bringing people in the door, right? And that's incredibly important as it relates to diversity. 67% per Glassdoor, 67% of job seekers consider diversity important when making a decision on a potential employer and where to work. And when you drill down even further and you look at minority candidates, the number skyrockets and it goes even higher. 89% of African-American job seekers consider diversity important in terms of when they're making a decision on an employer. So it's very important to us on the talent acquisition side. So that's the first part, right? We bring them in. We find the talent outside of the organization, we bring them in. Once we bring them in, then we ask ourselves, how do we keep them, right? And you know, when I say them, I mean all the talent that we bring into the organization. How do we develop the talent that we've identified and brought into the organization once we've, you know, hired them? And it's all about the development programs that we've got in place. We also work very closely with individual leaders within the organization to ensure that we've got things like stretch assignments and experiential learning going on. But we're very, very big on talent overall. Like I said, it's at the core of what we do. Every day when we talk about our goals and what we want to accomplish with my team in HR, it starts and it ends with talent.
You know, I really like how you outline those two pillars, because you hear that across multiple industries and you hear that in the community of healthcare, that it's retention and recruitment is so important, and bringing in that diverse population of candidates is key in order to have an impact on how care is delivered in a healthcare institution, as well as how you teach that new population of healthcare providers. So I really like how the two of you have outlined those two different things and brought that all together to create that picture for us to understand a little bit more about what we can potentially do and how we can potentially navigate, and then what this organization is doing as a whole to support students and to cultivate an environment where all colleagues feel like they're a part of something and that they can grow and stay within the organization of learning, such as at Talum and Chamberlain University.
Yes, if I can interject, Bill, I just wanted to say the resources and all of the tools that you all present, fabulous, fantastic, because you can bring in any warm body. That's not what we want, a warm body, but you go above and beyond, and the qualities that you're looking for, that's what we want. So like I said, any warm body can be brought in and hired, but I'm so glad that you go above and beyond to hire nothing but the best. Thank you.
Thank you, Dr. Jackson.
Oh my goodness, this is a love fest and I love it. So I want to go down the pathway of, you know, how do institutions, you know, we started the conversation about what we're doing as an organization to cultivate an environment that supports diversity and inclusion. However, I would love to hear from the two of you on some ideas that you may have that we can share with our community that is listening to us today about what they can do to help cultivate and support a diverse and inclusive environment in their institutions of learning, as well as their organizations, whether it be healthcare or non-healthcare organizations. And I'm going to look to you, Bill, first, and then I'm going to come to Dr. Jackson second.
Yeah, no, thank you. Great question once again, Tanya. You got great questions today. You know, organizations outside of ours are taking this very seriously right now, and I'm very pleased to see that. I think the first and the most important thing that organizations can do is talk about it, have open and honest conversations about what is going on in the world, in society, in this country, and talk about what they can do about it, right? Taking action. Because to this point, folks have mentioned the importance of diversity. You go out and you interview CEOs and you talk to global HR leaders and whatnot, and everybody talks about the importance of diversity. But in many cases, it's just sort of stopped there at the talking. Where we need to take it to the next level as a country and as a society, in my opinion, is putting in deliberate actions and things that have tangible results ultimately as it relates to diversity and inclusion with organizations across the country. And so in order to do that, you first need to have open and honest conversations about where you're at today, where you want to be, and what it's going to take to get there. And so we've been having some very real, raw, emotional conversations lately about, what's going on in the country as an organization, throughout it within small teams, on a larger basis. Our CEO, Lisa Wardell, regularly updates us on social justice and what's going on, and provides tools for people to educate themselves better in this area. And I would encourage more organizations to do that and to speak up and to talk about it. If your organization isn't talking about this openly right now, speak up and say you want to have the conversation and it's important to you.
Perfect. I'm going to go to Dr. Jackson next before I make any comments.
Okay. Well, thank you. And I do believe, I just want to piggyback on the question regarding what the higher learning, what we can do to cultivate and support the diverse and inclusive environment. Mm-hmm. And initially, what I think should be done is to take a good look at your team members. First of all, you want to make sure that you evaluate and see what's going on in their lives, what they like, what they dislike, what are some of the challenges, what are the ways that they prefer to be recognized. And I can say that because of the faculty that I have. Everyone is different, and supporting the diversity of each one individually it goes without merit. But at the same time, don't play favorites. And I know we all can attest to that because it happened to me. Yes, me. We all know that we have this one employee that will go above and beyond anything we ask or do. They just go above and beyond. You do it very quickly, and that's good. But you also want to go and develop others, give them a chance to develop. So don't play favorites. And also acknowledge and honor the differences regarding each one's cultural practices, their holidays, and even their offices. Because if you see different faculty's offices, you can see how different they are. But faculty also need to feel inclusive and be a part of the Chamberlain family. They want to be respected and have the ability to express themselves, as Bill says, in a welcoming environment. So this is something that leaders must possess and initiate.
No, that is spot on from my lens. When you think about it and you identify how, because diversity and inclusion is just not limited to race. And a lot of times people want to think about it from a lens of race. There's gender, there's religion, there is personal beliefs, and you have to be thinking about all types of things. So identifying with them and meeting them where they are. I think it's very important to meet colleagues or people or patients. So whoever you're working with, whether it be a student, whether it be a patient, or whether it be a colleague that you are dealing with, you have to meet people where they are and then engage and adjust so that you can help them get where they're wanting to go as we move forward as an organization. So I really do appreciate how the two of you talked about cultivating an environment where, we support diversity and inclusion, not just within Chamberlain and Adtalem, and, within the community. And it does start with conversation. And, we're very fortunate that we have the ability to have conversations, whether it's in a small team or whether it's on a grander scale, to have the conversation, to empower and embolden people to feel comfortable, to ask questions that they're may not feel comfortable with, in order for us to learn more about each other and move things forward in a progressive manner. And Bill, you said something that was so powerful: action. tangible things that we're doing in order to make things go in the right direction. You have to have action oriented items. And Dr. Jackson, identifying your team and looking at where you are currently and then taking it to the next level is a great starting point. So thank you both for, taking us down that pathway. Um, I would love to hear from you all about the types of initiatives, or in your opinion, let's go this way. In your opinion, why in 2020 rather, are we still having the discussion about diversity and inclusion in healthcare and education and in corporations? Because everybody says they have a diversity and inclusion plan, they have these processes in place, but why are we still having this conversation, you think? We can start with you, Bill.
I think it goes back to what I said earlier in that, look, leaders across the country, across the world, have been saying that diversity is important, right? When they've been interviewed, when they've participated in surveys and things like that, whether it's CEOs of Fortune 100 companies or, small businesses or whatever the case may be, folks have talked about it for a while and said that it's important, but I feel that in many cases it's ended there. They've talked about it and there hasn't been that action behind it, right? And I think that's why we're still talking about it. So I think on one end, I'm disappointed that we're still talking about it in 2020 and we're having to call it out specifically and have these conversations. But on one end, I'm excited that we're talking about it in 2020 because I feel like we're finally making significant progress and we've got really good momentum going, especially within our organization. But I'm seeing it throughout many organizations in this country. So I'm excited from that aspect, and I'm hopeful more than anything else. I'd say I'm hopeful that 20 years from now, or hopefully a lot less than that, we won't be talking about it the same way we are now, and it'll be a much different kind of conversation as it relates to how we can improve our organizations, how we can improve healthcare, how we can improve student learning and things like that. But we are still needing to talk about it today because it is still something that we can improve on significantly. So that's my sort of short answer, although it's not that short, about why we're still talking about it in 2020. I think folks have talked about it for a long time, but there hasn't been that action behind it, that walking the walk, so to speak.
It's my turn? Okay. Well, thank you, Bill. I do appreciate what you said. The question is, well, why are we still talking about it? You pointed out some very good points there on that subject. But in addition to that, we will continue to discuss diversity and inclusion as long as we live. When I think about it, I look back on history, because not everyone had the privilege or the right to attend school. And once that was lifted or it was made available, the system was not prepared for this change. As things progressed, there were lack of understanding of diversity and inclusion by many people, by many organizations. And as more diverse people were able to go to school, even today, even with Chamberlain, changes are being made to include and improve inclusion. And regarding healthcare, this country still remains divided where people live, even within a city. In rural areas, you see healthcare is very minimal and is lacking available resources. When you identify a rural area, you are identify that they are made up of a particular culture or ethnicity. Even in the city, patients are more likely in healthcare to be compliant if they are seen by someone who maybe looks like them, who maybe talks their same language, or similar to their culture. But in this diverse world, someone who may not look like them probably have all three. They can talk the talk, they have the language, and they know about the culture because they're made up. They're diverse people. But in most organizations, we see that the higher within the organization, as far as a administrative type, the less diverse it is, and it seems to be. So that's something that, like Bill said, we need to continue to talk about it. And having these sessions that Chamberlain provides, it's just a wealth of knowledge and wealth for everyone.
That is powerful when you really think about it, because you, when you when you're trying to cultivate change and you're trying to make things happen, you have to start with self, and then you have to think about all of these different factors that come into play in order to foster an environment that will support change. And Dr. Jackson, you said something that resonated with me. People may not have been prepared for this evolution that needed to happen when diversity became something that was on the frontal lobe of people's minds. And what inclusion means, and really going back to how you define diversity and inclusion, and how that is where you begin in order to make that evolution and take us to the next level, is going to be key. So, as leaders, you two are two dynamic leaders within our institution, and you bring a wealth of brilliance and knowledge to the forefront. What recommendations would you provide leaders such as yourselves to move things forward, to take action, and to, get involved and have these conversations with their organization and their colleagues? And I'll start with you, Dr. Jackson.
Okay, well, thank you. Well, as a leader, and you made the statement regarding self. We must allow bias and perceptions to begin with what I call Michael Jackson's music. One of the title of his songs, it begins with the man in the mirror.
Wow.
And that is yourself. We need to perform that self-reflection on our own definition of diversity and inclusion, on our own feelings. We must overcome those feelings and overcome our ways to enhance our understanding and ways to identify our personal strengths and challenges. As an organization, as a leader, to continue to utilize what HR has for us, and not just one time, but on a continual basis. Because that information is it's the wealth of knowledge that needs to be shared by many, but also include that in your staff meetings, in your faculty meetings, so that it's not ad nauseum, but it's also something that we can identify with, because on a continual basis, you always have new employees that come into your team. But also, one way of inclusion is to gather when you have committees within your group, having that committee be diverse and have them involved in decision making from the ground level. Not once everyone decides on how things should be or could be, but how the team wants them to be or how they desire them to be. And as leaders, we need to hold others accountable. So that's how I can envision that part.
Oh no, that is really key, because you hit on that diversity. That decision making again. You really hit on how diversifying those teams heightens and enhances how we make decisions and how we move forward. So no, that's not all. That's the beginning, and I love it. Bill, what would you add to that?
Tough to add to that, to be honest with you, because that was such an amazing answer, Dr. Jackson. I would summarize by saying this. Number one, the point that the two of you made earlier was so important, where you're talking about, as a leader, how you can lead and manage your respective teams. And that's something that we work on in HR regularly. When we coach leaders throughout the organization, when I've coached leaders throughout my career, one of the things that they struggle with the most is this idea of situational leadership. And when I say situational leadership, what I'm talking about is understanding that you have to manage every person on your team differently. It's not a one-size-fits-all by any stretch of the imagination. You have to understand what motivates people. You have to understand what their background and their experience is, and how that plays into ultimately their thought process and how they perform in their position and what they want to do ultimately. So situational leadership is so important, and something that we stress all the time. But it's, again, understanding where that person is, and to take your words, Dr. Jackson, it's meeting them where they are, right? And it's knowing that. And that's something that we focus on constantly. The other thing you said, start with the man in the mirror. You're absolutely right. Knowing that you're part of the problem if you're not doing anything to help with the solution, right? And so knowing that it is time to take action. It is time to look around you and see and think about, the makeup of your teams and making sure that you've got different viewpoints and different experiences and different ideas coming from folks, and just helping in any way you can in that regard. So, making sure that we are walking the walk now, right? And taking action and setting goals, right? I think that's so important for folks. Writing it down, setting goals, making sure that they're SMART goals, that they're measurable, right? And not just something that is on a piece of paper that you maybe look at once a year and you kind of go back and review. It's setting real goals that ultimately will, things that I say move the needle, right? Things that will truly make an impact at the end of the day.
Bill, I love SMART goals. And it is writing down those tangible bite-sized goals that will help you see how you make progress and adjust accordingly. And that's in all things, but especially when you're trying to take action when it comes to something of this magnitude, which is diversity and inclusion, and ensuring that people are moving things forward, moving the needle forward. I like to say that as well. And when you think about it from the lens of a student or the lens of a colleague or faculty member or anyone for that matter, you're meeting them where they are and helping them cultivate those goals and evaluate who they are, and then taking it to the next level is going to be key as we make decisions in order to foster an environment that supports diversity and inclusion. And I'm not just talking within Chamberlain, I'm talking about the community at large as well. So I really do appreciate how you all broke this down for us today and the insight and wisdom that you brought to our conversation. So thank you again for joining us. We appreciate our esteemed panelists and the dialogue between the three of us as we move forward. Join us next week for our next week's mastermind session, which will be a continuation on human trafficking up for sale. Thank you and have a great day.